What is a stroke? 1. Introduction to stroke. Stroke is a neurological disorder that occurs when blood supply to the brain is suddenly blocked or when a blood vessel in the brain bursts. When the blood supply to brain cells is cut off, they begin to get damaged within minutes, and without prompt treatment, permanent damage or death can occur. Stroke is one of the leading causes of death and disability worldwide, and the speed of diagnosis and treatment significantly affects the outcome. Two main types of stroke. Ischemic stroke occurs when a blood clot or fat deposit blocks blood flow to the brain. It accounts for 85% of all strokes. The main causes include atherosclerosis, heart disease, and high blood pressure. Hemorrhagic stroke occurs when a blood vessel in the brain bursts due to high blood pressure, aneurysm, or a vascular malformation. This type makes up about 15% of all strokes, and the severity depends on the amount of bleeding, which can lead to serious brain damage or death. Transient ischemic attack. This is a temporary interruption of blood flow that resolves on its own, and is often referred to as a mini-stroke. It is considered a warning sign for a full-blown stroke. 2. Causes of stroke. The primary cause of stroke is interruption of blood flow to the brain, or blood vessel rupture. The causes differ between ischemic and hemorrhagic stroke. Ischemic stroke. Atherosclerosis is plaques of cholesterol and fat build up inside the artery walls, narrowing or blocking them. Heart conditions is atrial fibrillation, irregular heartbeat, or heart attack can cause blood clots to form and travel to the brain. High blood pressure damages blood vessels, increasing the risk of clots forming. Hemorrhagic stroke. High blood pressure exerts continuous pressure on the walls of blood vessels, making them more likely to burst. Brain aneurysm with weak spots in blood vessels may bulge and rupture, causing bleeding. Trauma severe head injuries can lead to hemorrhagic stroke. Risk factors: high blood pressure, smoking, diabetes, high cholesterol, sedentary lifestyle, obesity, excessive alcohol consumption, and heart disease all increase the likelihood of stroke. 3. Symptoms of stroke. Stroke symptoms depend on the stage and the area of the brain affected. The symptoms are typically divided into stages as follows. Early symptoms. In the early stages of a stroke, neurological symptoms appear suddenly, often affecting one side of the body. Typical early symptoms include sudden weakness or numbness on one side of the face, arm, or leg. The face may droop, or it may be hard to lift one arm. Slurred speech or difficulty understanding others. Suddenly struggling to talk or comprehend speech. Vision problems is sudden blurred or lost vision in one or both eyes. Severe headache is a sudden, unexplained headache. Dizziness or loss of balance or coordination. Middle stage symptoms. As the stroke progresses, early symptoms worsen and more severe neurological deficits develop. Increased weakness or paralysis. Difficulty or inability to move limbs on one or both sides of the body. Complete speech loss is inability to speak or understand language. Cognitive impairment is confusion, memory loss, or dementia-like symptoms. Worsening vision loss is continued or complete loss of vision in one or both eyes. Late stage symptoms. In the late stage of a stroke, there is severe neurological damage with the following symptoms. Loss of consciousness is the patient may fall into a coma or become unresponsive. Severe neurological impairment is complete inability to speak or move, often leading to total dependence on others, breathing difficulties, and increased risk of death. 4. Treatment of stroke. The speed of treatment is crucial in stroke care. Stroke treatment varies depending on the type of stroke and the time since the onset. Treatment for ischemic stroke. TPA is this clot-busting drug. Can restore blood flow to the brain if administered within 4.5 hours of the stroke onset. Endovascular thrombectomy is a catheter-based procedure that physically removes the clot from the blocked artery. Treatment for hemorrhagic stroke. Surgery is if there is significant bleeding. Surgery may be needed to stop the bleeding or clip an aneurysm. Management of intracranial pressure is controlling brain pressure through medications or surgical intervention. Is essential in hemorrhagic cases. Rehabilitation. Multidisciplinary rehabilitation, including physical therapy, occupational therapy, and speech therapy, is key to restoring neurological function and improving daily living skills. 5. Folk remedies. Folk remedies for stroke prevention or recovery are widely used, though scientific support may be limited. Common examples include ginger and garlic, known for their anti-inflammatory properties and blood circulation benefits. Green tea, its antioxidant properties are believed to improve vascular health. Potassium-rich foods. These help lower blood pressure and may aid stroke prevention. 6. Emergency response for stroke. Immediate emergency response is essential when a stroke is suspected. The FAST method is commonly used to assess stroke symptoms. Face, ask the person to smile and see if one side of the face droops. Arms, ask the person to raise both arms to check if one arm drifts downward. Speech, check for slurred or strange speech. Time, if any of these symptoms are present, call emergency services immediately. Record the time of the first symptom and provide it to healthcare providers. 7. Health management. Exercises beneficial for stroke recovery. Aerobic exercise, walking, cycling, and swimming can strengthen the cardiovascular system and improve circulation. Balance exercises and stretching improves flexibility, balance, and prevents muscle loss. Low-intensity strength training. Gradually regaining muscle strength is important during rehabilitation. Lifestyle habits beneficial for stroke recovery. Quitting smoking. Smoking damages blood vessels and increases the risk of stroke. Maintaining a healthy weight, managing body weight, helps reduce the risk of recurrent strokes. Regular blood pressure monitoring. Keep blood pressure in check with regular measurements and medication as needed. Diet beneficial for stroke recovery. Low sodium diet is reducing salt intake, helps manage blood pressure. Mediterranean diet. A diet rich in fruits, vegetables, fish, and olive oil promotes heart and vascular health. Omega-3 fatty acids is found in fish and supplements. These help protect the cardiovascular system and reduce inflammation. 8. Related product types. Medications. Anticoagulants and antiplatelets. These prevent blood clots, which are especially important in preventing recurrent ischemic strokes. Examples include aspirin, warfarin, and clopidogrel. Hypertension medications. Managing high blood pressure is key to preventing strokes. Supplements. Omega-3 fatty acids. These supplements support cardiovascular health and may help prevent clot formation. Vitamins D and complex. These have been shown to offer neuroprotective benefits and reduce inflammation. Exercise equipment. Rehabilitation equipment. Walking aids, balance training devices, and treadmills are useful in stroke rehabilitation. Blood pressure monitors. Regular blood pressure monitoring is crucial for stroke patients. Other products. Emergency kits. Kits equipped with medical supplies and first aid tools for quick response to stroke symptoms. Stress relief tools. Meditation tools, biofeedback devices, and other stress management products can help reduce stroke risk and aid recovery. This information may vary from person to person. Therefore, for an accurate diagnosis, we recommend going to a nearby specialized hospital. Thanks for watching.